there is no news bigger than the news about LeBron James, his oldest son, the news that came out just over an hour ago, and it is terribly disturbing news out of Los Angeles. Bronny James, it is our breaking news. The 18-year-old son of LeBron James collapsed after suffering cardiac arrest during USC's practice. It happened yesterday. The family has released a statement in part saying that Bronny is in stable condition and out of the intensive care unit. Here's the rest of what the family had to say in the statement as we take a look. Yesterday, while practicing, Bronny James suffered a cardiac arrest. Medical staff was able to treat Bronny and take him to the hospital. He is now in stable condition and no longer in ICU. We ask for respect and privacy for the James family, and we will update media when there is more information. LeBron and Savannah wish to publicly send their deepest thanks and appreciation to the USC medical and athletic staff for their incredible work and dedication to the safety of their athletes, end quote. Stephen A. Smith checked in on the James family and shared these thoughts when the news broke earlier on First Take.
I was scared to death when I heard the news, checked with some people. They said he's okay. Obviously, before I saw the family statement, they were saying he's okay and he's doing better. When you hear something like this, you just thank the good Lord that the medical staff was there in attendance, that he wasn't practicing by himself with nobody around, that there were people there to see and what transpired and ultimately come to the rescue. And we don't know how it's cardiac arrest, so obviously it's serious, but we don't know the intricate details. I'm just thankful, thank the good Lord that he's doing okay and that whatever caused this is something they will identify and alleviate as soon as possible so he can restore his life back to normal.
Yeah, certainly some of the news coming out about this seems to be good as we welcome in ABC News Chief Medical Correspondent Dr. Jennifer Ashton. And Dr. Ashton, can you explain to the viewer what cardiac arrest is and what might have happened to Bronny during practice?
Well, first of all, this cardiac arrest, sudden cardiac arrest, is very different than a heart attack. Of course, a heart attack can cause sudden cardiac arrest, but remember, there's electrical system in the heart, there's mechanical pumping system of the heart. They both can go wrong. The bottom line is sudden cardiac arrest means there is no heartbeat. When there is no heartbeat, there's no oxygenation to the brain and the rest of the body. We know this is very, very rare when it comes to competitive athletes. It happens about 100 to 150 times a year in this country. And of course, it's human nature to say why, what could have caused this? You know, the vast majority of cases are caused by a congenital and previously undetected or undiagnosed congenital heart defect known as HCM or hypertrophic cardiomyopathy. But certainly you can have this happen in a structurally normal heart. We're all familiar with what happened with Damar Hamlin. That is a very rare cause, commotio cordis, or there can be an irregular heartbeat in the electrical system, an arrhythmia. Bottom line is immediate intervention with CPR and AED use absolutely saves lives. We have a saying in medicine, downtime every minute is brain function and heart function. And so obviously the news couldn't be better that Bronny is out of an ICU setting, but this is definitely a major medical and sports headline today.
Yeah, a couple of follow-ups, if I may. I want to start with the thing you said about incredibly rare for athletes. I want to take that one step further. How rare is it for someone of Bronny's age at 18 years old?
Well, we see it 100 to 150 cases in this country a year, and it always makes headlines for good reason. I mean, this is an elite athlete, someone who's in very good shape, who's used to physically pushing themselves, and it can happen just like it did with Damar Hamlin. And I think that we need to remember there's another saying in medicine, an increased risk of a rare event is still a rare event. So while we see it with competitive and elite athletes, the number overall, when you look at how many people are engaged in competitive sports and how many elite athletes are training and practicing and competing every single day, is still incredibly rare. But when that's your child, right, all it takes is one.
Look, everyone hears ICU, intensive care unit, and all of a sudden it seems to be dire, but we know that he is in stable condition. So what does that mean, going from the ICU to now stable condition? What does that tell you about his status?
what we call standard operating procedure. Any patient brought into the emergency room who suffered an out-of-hospital cardiac arrest, it would be standard medical protocol to observe that person, if not manage that person in an ICU setting. So we want to make sure all organ systems are functioning properly, most importantly, the brain, the lungs, and the heart. So after a cardiac arrest, it's not uncommon to leave a patient intubated with a ventilator, a breathing tube, so that their airway is protected, so that, again, we can assess neurologic function, cardiac function, respiratory function, and then kidney and liver function and clotting function as well. So all of that is routine.
Well, Dr. Ashton, we certainly appreciate your time this afternoon on the status of Bronny, 18 years old, in condition at the hospital. Doctor, thank you.
Thanks for watching ESPN on YouTube. For live streaming, sports, and premium content, subscribe to ESPN+.